Welcome to a mini talk for potential investors interested in improving GI symptoms and autism symptoms through microbiota transplant therapy. I'm Dr. James Adams. I'm the president and co-founder of Gut-Brain Axis Therapeutics, which is dedicated to healing the gut and thereby healing the brain of people with autism. So there's a major problem that current autism medications do not treat core symptoms. Current medications approved by the FDA only sedate patients and often have significant side effects like major weight gain. Our new treatment is microbiota transplant therapy. We've demonstrated through our clinical trials that it's very effective, substantial reduction in gut symptoms and core autism symptoms. We've demonstrated it's very safe, serious, zero serious adverse effects in over 100 participants in our studies. We've demonstrated that it's long-lasting, benefits lasting up to 2 years in our studies after treatment is stopped, and some patients have reported to us 5 years later. Benefits are still continuing. And we've proven in 4 successful clinical trials that it's beneficial. So what's very relevant is our new discovery that 90% of children with autism have harmful gut or bacterial and yeast metabolites in their gut. One classic example is paracresol. 17 studies. Every study shows it's elevated in children with autism. 3 studies shows it correlates with autism severity. The more of it you have, the worse your symptoms. It's harmful to the brain and body, and it's made by over 60 different gut bacteria. Our treatment, microbiota transplant, was able to decrease paracresol levels 90% down to normal levels by replacing harmful bacteria with beneficial bacteria, make good metabolites, not harmful ones. So our microbiota transplant therapy includes 3 major steps. First, 2 weeks of a potent antibiotic, vancomycin, to kill off much of the harmful bacteria. Then 1 day of a bowel cleanse, just like you'd have for a colonoscopy, to remove any remaining bacteria. And then 8 to 16 weeks of our microbiome capsules or a powder you can mix in milk or yogurt or dairy-free versions, and then take that every day. This special microbiota contains over 400 species of bacteria, unlike typical probiotics that are only 1 to 10 species. It has a long-lasting effect on the gut microbiome and autism-related symptoms because these gut bacteria engraft and stay in the gut for years. In our phase 1 clinical trial for children with autism, we found significant reduction in symptoms, 80% reduction in gut symptoms. Severe autism symptoms were on average reduced to moderate and then to mild symptoms, some children even dropping below the cutoff for mild autism. We found this treatment was very safe. 0 dropouts due to adverse effects in over 100 patients treated. In our second study, which was funded by the federal government, it's a randomized, double-blind, placebo-controlled study for adults with autism. We also found improvements in many autism symptoms in adults who had these gut problems and autism symptoms for 20, 30, 40, 50 years. They could still be treated. So the green bar shows the percentage improvement in each symptom for the treatment group. The orange bar is the placebo. We can see that for every one of 20 symptoms, the treatment group improved more than placebo. So for example, 65% reduction in tantrums versus 25% improvement in placebo, but also big improvements in GI symptoms, in aggression, hyperactivity, mood, self-injury, sleep, sensory sensitivity, stimming, and more. So again, this is not a cure, but it is a major improvement in both gut symptoms and in autism symptoms. The families who participated saw substantial improvements in their quality of life. One parent said, I believe the MTT trial was foundational for my son. He seems happier and more well-adjusted. He's less anxious in general, less OCD, more receptive to typical social interactions, including coaching and training. His troublesome behaviors and outbursts are now much less frequent and less intense. and he's sleeping much better, and his daily bowels are regular and normal. So how do we get the FDA approval? Well, we've also been investigating a related rare condition called Pitt-Hopkins. And for this condition, first study showed very good benefit with a capsule form. We've now started a powder study, and that study will finish in a little less than a year from now. And then at that point, we'll be able to apply to the FDA for approval. So we hope in 2 years from now, we'll have FDA approval of MTT for Pitt-Hopkins. For autism, because it's not a rare condition, we have to do more studies, but we're well along the way. We've already completed 3 studies for autism. We're now doing a dosing study to determine what's the optimal dose. Because believe it or not, even though we've seen good benefit, we think we might be underdosing. And so we're going to a higher dose to see if we can see even more benefit. And then we'll conduct our final phase 3 study, just like a phase 2 study, but much bigger. Many sites, many more people, but that study is going to require a lot of money. And that's where we're looking for more help from the autism community. Then when that study finishes, then we'll apply for FDA approval, and hopefully it will be on the market then. So there's a potential for our investors for very high financial returns, and what matters to us also is to help millions of people with autism. As I said, there's no drug currently approved for the core symptoms of autism, so there's the potential for very high profits. We estimate sales will be in the billions per year. Investors in our company will receive stock in our company and receive potentially very large dividends. We've already raised $7 million from over 70 autism families, and that's sufficient for our current studies in our new manufacturing facility. Families on average have invested about $100,000 each, ranging anywhere from $25,000 to $1 million, whatever level they're comfortable with. We're now raising $20 million for a final phase 3 study. Unfortunately, federal rules restrict investors in small companies like ours, what are called accredited investors. So in order to invest in a company, people have to prove they have an income of $200,000 a year, $300,000 a year with their spouse, or have assets of $1 million, which can include retirement funds. So those are just the federal government rules on who is allowed to be an investor. So why consider investing in our company? Well, by investing in our company, we'll help accelerate FDA approval for what's potentially the first treatment for the core symptoms of autism. And by investing, you can join 70 other families who are committed to making a difference in their child's life, getting this treatment to them and to the lives of millions of other people with autism. And then there's a potential for very large financial returns. We estimate our investors will receive back more than 120 times their investment by dividends. That's much higher returns in the stock market, which over 12 years might double your return. Again, this is just an estimate of the potential. And then we've also had 4 successful clinical trials. Although there's some risk in investing in our company, there's risk in investing in any company in the stock market. Because we have 4 successful clinical trials, that substantially reduces the investment risk. Then finally, we have an excellent team of dedicated researchers. We've been working together for 10 years with funding from autism families, from our university, from the federal government. And now we formed our company to take us to that final step towards FDA approval. So thank you very much for your interest in considering. If you'd like to consider investing, I invite you to come to one of our more in-depth talks where I'm happy to answer any questions you have. Just go to our website and learn about next dates. And also, if you have any questions, feel free to email me at my email address here. Thank you very much for listening and for considering to help us achieve our goal to get an FDA-approved treatment for the core symptoms of autism to improve the health and the quality of life for children and adults with autism. Thank you.